Hi, I'm Sarah Trott, and welcome to the Fourth Trimester Podcast. I'm a new mama, and this podcast is all about postpartum care for the first few months following birth, the time period also known as the fourth trimester. My postpartum doula, Esther Gallagher, is my co-host. She's a mother, grandmother, perinatal educator, birth and postpartum care provider. Fourth trimester care, our topic, is about the practical, emotional, and social support parents and baby require. And importantly, it helps set the tone for the continuing journey of parenting. Hi, this is Sarah Trott, and welcome back to the Fourth Trimester Podcast. We have a great episode today. We're going to be talking about postpartum wellness and empowerment tools for parents and their supporting communities. I'm honored to be joined by Dr. Eboni January, who is a board-certified OB-GYN. She's the best-selling author of Empowered Motherhood, and she is a Presidential Lifetime Achievement Award recipient, and she is a champion of holistic, equitable care. I couldn't be happier to be welcoming her on the show. She is known for delivering thousands of babies. I think you said 8,000, something like that, and counting. She's pioneered text coaching for underserved patients. And then you've also worked on creating accessible wellness tools for postpartum families. And so I'm really thrilled to hear about the strategies that you have helped share with other parents and now with all of our listeners today. So welcome to the show, Eboni.
Thank you. Thank you. I do appreciate it. I'm really excited to be on.
Wonderful. Well, I would love to hear you introduce yourself and share a little bit more in your own words.
Sure. So as you stated, I'm a board-certified OB-GYN licensed in 15 states, hence the ability to have delivered over 8,000 babies. I've seen a lot. I have done a lot, and that is really what inspired me to have written my book, Empowered Motherhood. I really saw the need for health literacy, right? We're really excited when women, become pregnant. They're really excited about the baby, but then when they get into the labor room, they become very anxious because now they have this human that they have to care for, but things can go bad very, very quickly. And so I really wanted to have a tool, a resource for women so that they become empowered and educated, not just in the labor room, but prior to pregnancy. I believe that preparation is key. And so on my journey to becoming, Dr. EJ, that's what most people refer to me as. On my journey, I found that I get a lot of feedback from patients, right? We become family, as doctors, we spend so much time with our patients that I realized that they were telling me exactly who I needed to become, and that was an educational resource. And so I needed to develop this book for my patients and in response to my patients because they were telling me that no one was really educating them. They were just kind of telling them what to do. And so I became essentially this educational entity for my patients so that we can become teammates in the exam room and beyond, and not just for the patients, but for the people who love and supported them. So hence who I've become, Dr. EJ, and I have educational tools to support my patients as well.
Wonderful. And this culmination of experience is the book, right? You've got a wonderful book to now share with the world.
Yes, I have book, I have courses, I have a masterclass on labor complications. I also have corporate wellness products for women as they re-enter the workforce. I've now partnered also with Dr. Marcy Crouch, who is fantastic, who has pelvic floor exercises and tools for women that spans age groups, right? So I do a lot. I do corporate wellness. I do the educational tools as well. And so I also advocate for equitable healthcare as well.
Incredibly exciting and important work. What's been the response?
It has been a great response. Actually, people are super excited. Women are very excited, obviously, because they want to know more about their health. And, it's funny because pre-pandemic, people, when I was so out there, I was at every health fair, I was educating on preventative medicine, I was at, speaking on breast cancer, ovarian cancer, and people were receptive, but they weren't really excited, right? Post-pandemic, now everyone is excited. So although the pandemic was, a bad thing, post-pandemic, people are now more excited and they're eager for information. And so I have had a great response. And unfortunately, the maternal health crisis has really led people to want to know even more because they want to prevent these bad outcomes. So I've had a great response from not just women, but the people who love them. And I've had a great response from men as well, because unfortunately, when you have women who are dying secondary to childbirth and the complications, you have men who are now becoming parents, and then the grandparents who are stepping in to support these men. So it actually has been a great response.
I can imagine. And we don't want to leave men out of the picture.
No, absolutely.
I've
Yeah.
talked to gentlemen doctors who specialize in, perinatal periods and psychiatry, and they've made the point. We go to these checkups and it's like we get thanked for driving the woman to the appointment, but no one's asking us about our mental health. No one's asking us about
Exactly.
our health history, and we're part of the family too. Right?
Absolutely. Absolutely. And I did this video, and in fact, one of my programs for the corporate wellness is dedicated for men. And in fact, I have downloadable guides on my website that are dedicated for dads. And one of the programs that I talk about and I help to support is run by Brad Edwards. He has a program called Dad's To-Do List, where he trains dads to become doulas. And he's an amazing person. And I always say that dads can no longer be innocent bystanders in the exam room or the labor room, right? Because it's so important, and also on their psyche, because they have to deal with these highs and lows that we have to go through as women, not just in pregnancy, but also menopause, right? Perimenopause, menopause, they have to go through it with us. So we got to check in on these fellas, right? So that's very important that we cannot leave them out, we really can't. We have to check in on them.
Yeah. And I also acknowledge there are plenty of single parents out there too. And this is also just equally as important for them too. But I like that you're specializing in offering some resources specific to dads, because I've heard time and time again, they often get left out of the picture. And, they get postpartum anxiety and depression too. And it doesn't get mentioned that much.
Absolutely. I have some free resources on my website for men as well. Any men out there listening, make sure that you go to my website, drej.com. I have Dad's Guide to Labor on my website.
Cool. We'll make sure to put all the links in the show notes for this episode so you
Yes.
can find those easily.
Yes.
Well, we've touched on maternal mental wellness, and that's a big part of the conversation today.
Mm-hmm.
Where would
Yeah.
you like to start with that?
Well, one, it's one of the top causes of morbidity and mortality in the postnatal period. And one of the things that we do is that we plan for baby showers, we plan for weddings. I believe that we need to plan for the postpartum period, because our postpartum mental wellness suffers quite a bit. You need to make sure that you are having, just like you have a birth plan, you need to have a plan for your postpartum wellness. Whether it's a yoga instructor finding yoga programs, even if it's on YouTube, you need to make sure that you're having that plan for your postpartum period. Who is it building up your support system along the way, even before you get pregnant? Making sure that you have that village, that you're seeing who your village is prior to pregnancy, during pregnancy, because you're going to need a break. Making sure what your schedule is. Like I stated, whether it's a yoga instructor, whether if you're going to journal, what are the things that you're going to do to work on your wellness while you're pregnant? Build that plan up. Just like you're planning for your pregnancy, your wedding, your baby shower, you need a plan now if you are pregnant. I cannot reiterate that to you enough. And the fact of the matter is, if you were, let's say you've had two or three pregnancies that have been amazing, you didn't suffer from postpartum depression or postpartum blues, that doesn't mean that you won't suffer from it this time. You need to make sure that you have these things in place. And if you have a history of depression or anxiety, you're at increased risk for postpartum depression, postpartum blues. So you want to make sure that you plan for your postpartum wellness. So, and that's so important. Right. And men as well. We have to plan for that postpartum wellness side of things. And that means a planner. And you can plan all day. I make this statement where people ask me, as a professional woman and someone who sits on boards, and I do this and I do that, how do you stay fit? And I tell people I plan for crazy, right? Because even though I may have my gym clothes ready, I may meal prep, there's going to be something that happens, whether it's a baby that comes at 2 a.m. or 4 a.m., there's going to be something that happens that throws my schedule off. And I tell people I plan for crazy. right? And so there's going to be something that throws that wellness calendar off, and that is absolutely okay. I have contingencies. And so even if you build that wellness calendar out to a T, have contingencies, have a backup person in place, but build that village out to make sure. And also, whoever that village is, you want to make sure that they check on you no matter what. The village that's out there listening, check on that woman no matter what. And don't just ask, how are you doing? I want you to ask, how are you really doing? Right? And I want you to understand that postpartum blues or postpartum depression doesn't just show up in the cries. Sometimes it shows up as silence. And so really pay attention to language. Pay attention to someone being withdrawn. It doesn't just show up as cries. And so that's very important. It's important as women that we plan for our postpartum wellness, but as support systems that we pay attention.
Expectations are so important as part of this conversation. So
Hmm.
your point about plan A, plan B, having a
Yes.
backup, because things might not go the way you planned. You could plan
Hmm.
everything so perfectly and
Yes.
design exactly the experience you want, which is incredibly important.
Hmm.
And also, if something goes wrong, being prepared for that. I love that because, or not even wrong, just differently. Being prepared for something to go differently than you planned is so important. And to sort of acknowledge that that might happen beforehand so that you're not spinning in the moment of like, oh no, what do I do? Especially for anyone out there who's type A and wants to.
Yeah, yeah. Absolutely. Absolutely. We know that the postpartum period is going to happen, right? It's like, buying an umbrella knowing that it's going to rain, right? We know that a storm is going to happen. So why buy an umbrella, after a storm? We should have umbrellas no matter what, right? So we have to make sure that if we're going to get pregnant, make sure that we have a postpartum plan. Candles. It's as simple as having a candle, having, aromatherapy somewhere around. It's that simple. Whatever works for you, a journal. Those small things matter.
And you mentioned some of the things that people can look for when they're visiting as a support person, things to look
Hmm.
for. And so what are some of those early warning signs of postpartum depression or anxiety? And what's the difference between that and just regular baby blues?
So irritability, excessive sadness, those are some things withdrawn. If someone who does not want to interact with the baby, if it's persisting past 2 weeks, then it's postpartum depression. Under 2 weeks, it's postpartum blues.
Do most people get the postpartum blues then, and that's pretty normal?
Most people will get postpartum blues. That's pretty normal. But if it's over 2 weeks, it's postpartum depression. Under 2 weeks, postpartum blues.
Hmm. And it could look different person to
It can
person.
person to person, it can look very different. And keep in mind, pregnancy to pregnancy, it can look different as well.
And I've heard people mention rage on that list of symptoms before.
Oh yeah, right. And sometimes now there's also a different category, and I break this down in my book, is psychosis as well. So there's a different category as well, which is postpartum psychosis. And this
And
is
that's
where
more rare. Is that right?
and that is very rare. That's very
Okay.
rare. Hmm.
Okay. And what is that?
So psychosis, this is one of the extreme. This is where, unfortunately, where they can lead to homicide of the baby as well. This is where, they become more aggressive in nature as opposed to this extreme sadness and irritability. They become violent. Disconnection delusions as well.
Thank you. I want to make sure we cover the basics in all these conversations. So thank you.
Yes, absolutely. Absolutely.
And then how can families help create a support system to address these symptoms?
So some of the things is, like I stated, we need to make sure that we create more of a system to check on. So if you have 4 people in your village, let's say we have Sarah, we have Katie, we have Ebony, we have Susan. Susan checks on Monday, Ebony checks on Tuesday. We need to make sure that we create a system for checking in on this person, right? We need to make sure that we lay eyes on the person. We need to make sure that we create meal trains. For example, my best friend, I didn't buy her anything. I think I was telling you this. I didn't buy her anything for her baby shower, and it's my god baby. I didn't buy her anything. You know what I did for her? I sent her catering every single week for 6 weeks because I knew that it would have just been too much for her to cook because her family they don't eat leftovers or anything. So I made sure that that was one burden that she did not have on her plate, that she had this. And I surprised her and flew into town at the 2 month mark, and she lives in Miami. I rented out a yacht, surprised her. I had her oldest watch the baby, and I took her on a yacht. So it's just those things. Now that's a big thing, not a little thing, right? Not everybody's is able to do those kind of things, but I made sure that I took her and I told her that I was taking her on a spa day. But it's those little things that we're checking in, we're taking them and giving them a break, right? Those small things, making sure that we just lift the load, we lighten the load. I know that her family doesn't eat leftovers. She's the person that cooks. No one else cooks in the house. So I just simply lighten the load. The baby's going to be fine as far as clothes and the cute little stuff. I'm not going to buy another onesie. Yeah, I'm going to buy food. They have to eat. And so those small things that actually weighs on the psyche of a mom, the excessive tasks, those weigh on the psyche of a mom, right? And so I just lighten that load. And so those are the things that we can get meal trains, that we can pay for some type of yoga. Those are the things that actually lighten the load and don't push moms into further depression.
Hmm. I really like that suggestion. And I think some of those modern baby registry sites allow for funds to donate.
Hmm.
You could say, please donate to my fund for, you mentioned yoga as a service. You could
Yes.
say, donate for a postpartum doula.
Yes.
Donate for other kinds of services, maybe body work, massage,
Yes.
postpartum. Maybe it's for food deliveries. I love that story. Thank you for
Yes.
sharing it. I love that you did
Yeah.
that for
Yeah.
someone. And what a great example.
Yes, and we're really trying to get organizations and jobs to really start supporting this. It's time for them to step in, to understand. A happy mom is also a productive employee.
Oh, absolutely. The economics
Yeah,
of the fourth trimester. That's a whole other
yeah,
conversation we've had on this
yeah,
program. Yep.
yeah, yeah.
And then mental health support
Mhm.
specifically. What would you say there?
So I've met so many mental health therapists that it is so needed. I personally think that this is something that employers need to implement no matter what. I think that all moms, if you're out there listening, make the appointment no matter what. OB-GYNs, make the referral no matter what. When they come in for their postpartum appointment, make the referral no matter what. I don't care what they score on our survey. Make the appointment no matter what, please, because they don't always tell the truth. The patients are going to say, "This is what happened, Sarah." They say that they're fine because they want to get back to the baby. They want to get back to the 2-year-old. They want to get back to the 3-year-old. Make the appointment no matter what. Even if it's just a virtual visit, make the appointment no matter what.
Yeah, that's one of the
Yeah.
wonderful benefits of technology, right? Even if
Yes.
you live somewhere where you don't have easy access,
Yes.
virtual appointment. And you could even schedule that appointment before you have the baby.
Yes. Oh, absolutely. In the hospital, we make many of the appointments in the hospital before they leave. We make the babies appointments. Before they leave, we make the postpartum appointments. We make blood pressure checks before they leave. So I think it's important that we make it, even if it's just one appointment where you see the therapist. I think we should start making those before they leave.
I love that. I'm going to call you Dr. EJ because you said that at the beginning. I really like that. So cute. So, Dr. EJ, why? Why are you saying this? Why is it so important to make that appointment?
It's important because, one, as I stated, because most moms, we're missing the diagnosis. It is the top cause of maternal morbidity and mortality, mental health issues, right? Moms are saying that they are fine and they are not. So we need to make the appointment before they leave the hospital. And if we're not making the appointment before they leave the hospital, then we need to make the appointment at their follow-up visit,
Hmm.
because we have the ability as OB-GYNs to catch many things that the primary care physicians that they don't, right? Because they're going to come see us. You all are going to come see us, right? You come for your well woman's exam, you come for whatever, but you may not go to the primary care doctor, but you come to see us. So I think that it's important for us to make those appointments because we catch so many things. And unfortunately, you all will say that you're fine. But it's a top cause of morbidity and mortality amongst women, especially in the postpartum period.
Yeah. And even if someone is quote unquote fine, there are huge benefits for talk therapy.
Absolutely. Absolutely. Mental health, I just spoke with someone yesterday. Many times when women come in for physical ailments, it's really a mental health issue that is presenting itself as something physical. And so it's important for it to be addressed. The mental health is so important that it crosses over into everything in our lives, right? So there's something I'm not sure if you've heard of the wellness wheel. But the wellness wheel encompasses, depending on which wheel you look at, 7 to 8 aspects. You got the mental, the physical, the financial, the social, occupational. So these different aspects. And when your wheel is off balance, then you're off balance, right? But that mental component is so important. And when you don't address it, then everything just kind of is out of whack. And so it's so important to address it. It's the foundation for everything.
And so, what do you talk to patients about when you see them postpartum?
So when I see patients postpartum, obviously, we're going to address the physical. That's, we're going to talk about the blood pressure. We're going to talk about, how they're healing. We're going to talk about the baby. But from the mental health aspect, I'm going to obviously ask about who's helping you. Who's helping you? What is your routine? What is your mental health routine? Many don't have them, and then I point them in the direction of resources. I make sure that I have resources that are available, whether it's just simple as a website, because most times women don't necessarily want to leave the house. They don't need something extra. So whether it's mindbody.com or Calm, just or YouTube University, everyone loves YouTube. So those are some of the resources and simple journaling as well.
I like that you're coming up with practical things people can do because, it's easy to just say, oh, well, be nicer to yourself, or like, what does that mean?
Yeah,
You
yeah,
know?
yeah.
So I appreciate those real examples of things people can do.
Yeah.
Are all of these tools also beneficial for prevention rather than treatment?
Oh, absolutely. So, and I mentioned this earlier in the conversation, is that you have to set yourself up for success before, right? It's important that you create good habits before. So if someone remember I said that if you have a history of depression or anxiety, that you're at increased risk for postpartum depression, the blues. We want to make sure even if you're on medication for depression or anxiety, you want to maximize that. You have to create good habits before you get pregnant, while you're pregnant. It is so important for you to create those habits, for you to find those resources so that when you in the postpartum period, that now you have another human. So you've added another stressor, right? So it's important for you to create those habits prior to you adding another human on your plate, right? So it's important for you to find what works for you, even if there's some trial and error. So journaling may not work for you. Yoga may not work for you. Not everyone likes yoga. Not everyone likes journaling. Not everyone likes meditation. Most people do like meditation, but some people can't get into the habit of meditation. And some people even with yoga, some people need a partner, right? And so I think it's important for you to get in the habit, find what your niche is, what the thing that really works for you. And so that is what some people love. I had a client who played in the NFL, and he found yoga to be the best thing ever. They used to call him Big Angry. Okay. They called him Big Angry. That was his nickname. And he found yoga to be absolutely beneficial. So you have to find what works for you and do it before you get pregnant or while you're pregnant. And that is what's going to really help save you. Prevention is key.
Yes.
Mhm.
Yes. And
Yeah.
you've mentioned partners in this conversation a couple of times. What a
Mhm.
great way to bond with someone too. To do
Absolutely.
the planning process together, to discover what you both want to be doing together before and
Mhm.
after baby arrives.
Yes, do it. It is so important to bond. It's absolute. And my best friend, that's what she did. They did yoga together, and it was so important because remember, you're going to have those highs and lows with your hormones. And so when you find that way to bond, especially as it pertains to your mental health, it's going to help. It's really going to help. And people find that their relationships become stronger.
Mm, yeah. You can't
Yeah.
forget that. You have to tend to
Yeah.
that garden.
Absolutely. Absolutely.
Well, tell me more about empowered parenting. What do we mean when we say that?
So when we say empowered parenting, empowered motherhood, it means being educated. The one thing I notice is that many people they come in with birth plans, right? And I'm all about birth plans. I know some doctors are like, oh God, a birth plan. Because many times they're not malleable. They want people want what they want, and that's okay. But when you have a birth plan, when you're empowered, you want to make sure that you inform, that you educate yourself. So remember early on, I mentioned the master class that I had, and the master class is on labor complications. And I specifically put labor complications because things in our world go crazy very, very quickly, and we don't always have the time to say, "Hey, Sarah, we need a C-section, and we need it now." And I need to explain to you this is why we need a C-section. And I don't necessarily have the time to go into every single detail as to why you need a C-section because 1 minute can mean the difference between you having a live birth, a live baby, and not a live baby, right? And so I think that it's important that when we talk about empowerment, that you are educated and you don't wait until the last minute to be educated on your health and your pregnancy. And so when you talk about empowerment, it comes in the form of health literacy and education. And so you need to be educated throughout. Don't wait until the last minute to be educated. When you talk about a birth plan and you check off the box to I don't want an epidural, know why you don't want an epidural. If you don't want a C-section, know why you don't know we talk about contingencies and backups. If this, then this algorithm, know why. Know why. Bradycardia. Know what bradycardia means. That means low heartbeat. And that means that if you have a low heartbeat, then I may not have a vaginal delivery. And so on my birth plan, this is about education that I've been educated enough to where I can put this on my birth plan. So when we talk about empowered parenting, empowered motherhood, that means that I've been educated to where I can have an informed conversation, make an informed decision with my doctor. And I'm a teammate. That's what that means. I'm an empowered parent because I am an informed and an educated parent. That's what that means.
And those things that you put on a birth plan, those are intentions.
Mm-hmm.
They're not necessarily a guarantee.
Yeah, they're not a guarantee. They're not a guarantee. So you have to, I think it's important that one, you discuss it with your provider prior to, and that you're educated to know that this may not always go as planned, that you be reasonable, right? That you don't just go and say, hey, I want this, and that is the only thing that I want. You have to understand that sometimes things don't necessarily go as planned. I know that it's called a birth plan, but plans change.
Yeah, I love that
Yeah.
point.
Yeah.
And the education piece, so
Mm-hmm.
important, right? And
Mm-hmm.
you can go to all the classes at the hospital. You'll be amazed how much more you end up learning having gone through the
Yes,
experience.
absolutely.
Yeah, it's a really
Yeah.
eye-opening experience becoming a parent.
Yeah. And many people don't go. And that's the craziest thing. And that's why, as I stated, I was intentional about the master class because I wanted people to see from our perspective. I wanted to introduce you into our world because we're getting into the day and age where birth plans are more popular, but I wanted to introduce people into our world to show you that we are humans and we're not trying to be unreasonable when we look at your birth plan and things don't necessarily go as planned on your birth plan. These are what happen. This is what may happen, and so that's why I was specific and strategic about why I made the masterclass on that particular topic to show you that this may happen, and this is why. And I wanted to slow it down because when we get in the moment when it's game day, it may not. I don't have time to. We don't necessarily always have time to break things down for you, and so that's why I did it that way.
Yeah, and don't wait until week 38.
No. No, please don't. Please
Do
don't.
it.
And another thing, ladies, if you are in a large practice or a practice in general where there are multiple doctors, make sure you meet a majority of the doctors because your doctor may not necessarily be the person that delivers you. Meet the midwife, meet the nurse practitioner. You're making a point to try and meet everyone.
Yeah. Yeah. So
Yeah,
it's a little bit familiar and they know you too. I
absolutely.
like your point. I've heard people make the point about how important it is to socialize your birth plan to make sure you have people in the delivery room who are on board and can support you with that,
Mhm.
who appreciate the things that you're trying to achieve. So
Mhm.
even if it doesn't go the way you want, at least they're there to support you and know how to do that.
Yes, yes. So we're in a day and age of doulas, right? I love doulas. I really do. And I'll tell you why, and I'll tell you a story. I was recently in New York, upstate New York, and I had a doula practically save a patient's life.
Wow.
She, at the last minute, told us a piece of information that stopped us from giving a patient an epidural. And the patient had a bleeding disorder, and had the anesthesiologist given the patient an epidural, she would have caused the patient to have had a hematoma that would have paralyzed the patient.
Wow.
But when she gave that piece of information, so the patient didn't remember. So when we admitted the patient had forgotten this piece of information in her medical history, but the doula had remembered. And so it was amazing that the doula was in the room, and not just sometimes dads remember, and
Mm.
sometimes grandparents are in the room and they remember. And so I think that that's why it's so important that you have people and supporters that are in the room that pay attention and they come to the doctor's office with you.
What an incredible story. Thank goodness. Thank goodness
Yeah,
she spoke up and said something, right? So doulas, or you're mentioning other support people, they can step in and advocate. And
absolutely.
I'm not surprised that woman forgot to put a detail in her health
Yeah.
history. Like
No.
being in labor is a otherworldly experience, right? So you can't
Mhm.
be expected to remember every little thing when you're having
No.
a contraction. That's just not realistic. So thank goodness. What a cool story. And I appreciate you speaking as a medical healthcare professional and saying, hey, I love doulas because
Yeah,
they're part of the team.
yeah, absolutely. Everyone's a part of the team, right? I remember, one of the things I used to do when I was operating on patients is I would say, when they would come in for their pre-op visit, I would break down everything that I'm going to do. We're doing a hysterectomy. I'm going to break things down. And then I would have them come in for another visit, but I would tell them, bring the person who's going to bring you to the surgery center because I'm going to draw these pictures and do the same story for you or the same process for you and them. And they're like, why, Dr. January? I'm tired of coming. And I'm like, I'm still going to do it and bring them anyway. I want the person who loves you to hear this same thing. And I don't care how many times you hear it because it's important for it to be a team approach. I said how I deliver healthcare and how I practice medicine is a team approach. And so I know that it may be annoying to you, but I want them to know that this is a team approach. And so it's the same way in the labor room for me. And so I want to know these things. And pregnancy brain is a thing. You
Yeah.
forget things. You forget things. I have moms who have 2 and 3 and 4 children, and so they're gonna forget things. They're worried about, the children at home and so it's really important that we have supporters that can remember things that while moms are worried about other things or that they forget.
Mm-hmm. And postpartum too, to help
Oh,
advocate.
absolutely.
We want people to feel seen and heard and supported, right? And
Absolutely.
advocacy is such a big piece of that. So what are some strategies that you've seen work well for that?
One of the things I would say, as I stated before, is you want to make sure that you have a great working relationship with your doctor. One of the things that I've seen that not work is how we communicate with one another. Many times there's an adversarial relationship, and I want people to understand that we are not adversaries. We should truly be teammates. So it's important on how we speak to one another, how you ask questions when we say, "Hey, I think that it's important that you have a C-section." It's as simple as saying to the doctor, Okay, doctor, can you explain the risk to me? Is this necessary? How we speak as opposed to, is this necessary? Some people say to doctors and how they speak to nurses is not necessary, is pretty disrespectful. So I think that it's important how we speak to one another is extremely important. And all people, many people can be very nasty to healthcare providers. So I think that it's important that how we respect each other is so important. But also your line of questioning. It's okay to ask, what are the risks associated with this? Is this necessary? Can I wait? Do I have time to think about this? Can you give me more information? I'm one of those doctors. I will print information out for you in a New York minute because I want time, and I will give it to you, and I'll tell you I'm going to step out of the room, read over it. I'll be back. And when I come back, do you have more information? Do you have any questions? Do you need more time? And if it's something that I need to move quickly on, then I'll let you know. So the line of questioning that you ask your doctor, that's how you can advocate a little bit more, asking for policies and procedures because every hospital, every facility should have policies and procedures. That's very, very, very important. And understand that every hospital, every facility should have policies and procedures, and how your line of questioning should be very important. You should ask, is this necessary? How quickly should this be done? That's very important, right? And also, what are the risks associated with it? These are ways that you advocate for yourself, but also when you do, how you ask the question is very important. Be respectful, okay, and be very mindful that doctors, nurses are humans as well.
I've also heard people recommend the question, what would happen if I didn't do this? What would happen if I didn't follow?
And that is a very, very good question as well.
And to be respectful, I mean, that works in both directions, of course.
Yes, absolutely. Same thing. Doctors, nurses, you have to be respectful as well. I've seen it go both ways. Absolutely.
Yeah. Dr. Ebony, what else would you like to share on this topic? Is there anything that we haven't covered that you really want to get across?
I think that it's important that when we talk about advocating and you ask the question, make sure that you verify understanding. So when a doctor or nurse is consenting you for a procedure or something that has to be done, repeat back to them in your own words what you think that they have said to you. Because when you do that, that verifies your understanding of it. And I think that that is so important that you have learned and that you understand what they have said to you.
Mm-hmm. Yeah, to your point about empowerment and education, there may be terms that you're not used to using in everyday language.
Mm-hmm. Yes. Yes, absolutely. And that is where we talk about health literacy. And that was my main purpose for writing my book because I wanted you all to understand that an empowered patient is a literate patient. And so many times patients see us as here. And because of that, you all feel like it's very cumbersome having certain conversations with doctors. And so you ask no questions at all. And so doctors feel as though when patients do ask questions, then they feel as though, okay, I have to start at the elementary level. And so when this book is about bridging that gap. And so an educated patient is an empowered patient, and now we're bridging the gap between doctors and patients. And so that's what this is about, and making sure that this is what we call the teach back method when I say explaining things back to the healthcare provider in your own words, knowing that, hey, I've looked over things. I know what the word preeclampsia means. I know what the word gestational diabetes means because I've done the work. I've done my work and you've done your work, and let's make this decision as a team.
Beautiful. Any final thoughts you want to leave us with?
Yes. Don't wait until we get into the labor room to be informed on your health care. Do the work. Plan for the postpartum period just like you would plan for your wedding and a baby shower. know more about your health than you know about your favorite reality show star. The time to know more about your health is now. I don't think that the pandemic should have exposed our lack of health literacy. I think that we should have been proactive in our approach. But now that we know that we should have been proactive in our approach, it's time to take charge of our health and make sure that we are prepared for anything that comes our way.
Lovely. Thank you so much for being on the show today.
Thank you.
You can subscribe to this podcast in order to hear more from us. Thank you for listening, everyone, and I hope you'll join us next time on the Fourth Trimester. The theme music on this podcast was created by Sean Trott. Hear more at soundcloud.com/Sean Trott. Special thanks to my true loves, my husband Ben, daughter Penelope, and baby girl Evelyn. Don't forget to share the Fourth Trimester podcast with any new and expecting parents. I'm Sarah Trott. Goodbye for now.
Hello again, bicycle man. I know you're doing all that you can. I wrote the song, simple and true. I wrote the song, I'll sing a song for you. You got your wheels, you got your gears. You ride around town without any fear. You got your pedals, you got your brakes. You always wear your helmet for safety's sake. Hello again, bicycle man. I know you're doing all that you can. I wrote the song, simple and true. I wrote the song, I sing a song for you. Hello again, bicycle man. I know you're doing the best that you can. I wrote the song, simple and true. I wrote the song, I sing a song for you.